And so we really looking for collaboration. Dentistry, Complete Health dentists are really looking for partners. We need partners. We want to support the healthcare team. We want to support doctors. We want to support nurses, nurse practitioners, chiropractors, nutritionists. It really is going to take the whole community to make a difference, to make an impact on all the waste that's preventable. And if America's going to be healthier, if Carmel Valley, Del Sur, this whole area is going to be healthier, it's really going to take all of us. And so you guys being here tonight is really special. I mean, you guys care and took time away from your family and your schedules to be here. So thank you. I want to acknowledge you for that. I have no idea where this is going. This is the first time this has been shown on the West Coast. This is really been shown across the East Coast and in the Midwest. But this is, as far as I know, this is the first time this has ever been shown on the West Coast. So I don't know where it's going to go, but I want to be a part of it. I want to get people healthier, and I know you guys do too. Just really looking forward to collaborating with you all and looking to see what we can do to get our. Let's start right here. Let's get our people healthy here, and then we can get people healthy here and people healthy here. And so thank you so much for being here. I really appreciate it. Anybody that's super nerdy like me and wants more information, this is a book that I provide for anybody that's interested. This is a compilation of the most recent research data on the oral systemic connection. So if you're like really into it, really nerdy, and just love it, everything you ever wanted to know about the oral systemic connection is in here, and it's I can't take the whole credit. It's really through Dr. Lee and the American Academy of Oral Systemic Health really helped compile this. I can slap my name on it. But anyway, anybody that's interested, see Lisa, my wife, at the table. But anyway, welcome. If you guys want to stay and hang out. Part of my personal mission is that I like to enhance people's lives through health, wellness, and fun. So this is all health and wellness. The fun part, anybody wants to stay, drinks are on me. If your weekend's starting.
Question is,
sure.
When somebody goes in for blood work and their SED rate is high and they can't find any other reason for the inflammation, do they check for gum disease?
No.
Yeah?
No, they don't.
So I just want to, we have
I know that too.
So we're obviously trying to bring this out to the community. We're really lucky. I think we've got nurse practitioners in the house. We've got nurses. We've got other dentists that are here. We've got.
I, as an OR nurse for all these years, how can I be an advocate other than in the community, outside of the OR? Because once I get it, it's done, you guys. It is done. And it's really, really sad. And I'm tired of looking at it. And I have to compel all of you, however you can impact this situation, to do it, because it does start in the mouth. It obviously does. And I see these horrible results, just like we saw in all these aspects. And I would compel you all to do something about it.
Talk to our neighbors, to our network, work,
to
all of us,
to
to
do
share.
something, because Brian, he's such a catalyst in this realm, and I see the horrible results, and you never ever want your family members, your best friends, anybody to be subjected to this. So, yay, thank you for bringing us all together, and I hope that we can make a difference.
Like the whole mission of Partners in Complete Health is just about education. I was getting lost. Just spreading the word, and believe it or not, there's even dentists out there. I mean, I'm working with my colleagues. There's resistance, fear to talk about people's health other than just their mouth. Like dentists don't feel like they deserve to talk about patients' total health. So it's just impacting dentists even to
Well,
teach them that
we
they.
even have patients, some of our own patients will ask, why are you asking who my primary care is? Or I treat only children, I'm a pediatric dentist, and they'll ask me, why do you care if my child's vaccinated? Why do you care, Well,
We have to, as a community, gently change that
right.
aspect, because I see the disaster. And you guys are on the front line, and it transcends through all of us.
What is your recommendation on how to go about letting other health professionals in other areas of the United States view this document? I was extremely impressed, and connections in other places, and
Sure.
for them to see this and
So
to do something similar to what you're doing.
right. Thank you for that sharing that. It's a great question. There is a group of dentists like myself, Complete Health dentists in different parts of the country, and through the Partners in Complete Health are just now starting. And this has only been shown probably less than 10, 15 times. So
In
there's
the whole United States.
in the whole United States. So
Puerto Rico.
you guys are like, this is the first time in this special screening. Sorry, next one is going to be Kanye West and Kardashian. At their weddings and part of the reception. So, but here we are. Here we are on the West Coast, here in California, and supposedly one of the healthiest places in the country. We're not. We're not. Vermont beats us. So, anyway, we are looking for opportunities to share this. I'm looking for opportunities to share this. Like I said, I took off my dentist hat, put on my ambassador hat. I just personally, like, my one of my purposes in life. I want to bring health and wellness to people. So, if this is a tool to help that, and you know of a way, in this room, anybody that thinks it's valuable for their community, their own little small community, wants me to bring it to them, we're happy to bring it to them. And I'm just one guy. I can do it a few times, but I have a network of other Complete Health dentists. People are doing it in New York, in Michigan, Ohio, Florida, all over the place. So, like I said, you guys all know. You don't have to tell me each other. Healthcare is changing. So, in dentistry is changing. We're, dentistry, at least Complete Health dentistry, is trying to change it in the most positive way possible. So yeah, we're looking for partners. We're looking for collaboration. We want to transform healthcare. The costs are so significant and impactful, and for preventable diseases.
Yeah, I was just going to say, we're talking a lot about talking to other healthcare professionals, but I think as healthcare providers and professionals, it's important that we're talking to the public and the people about taking responsibility for their own health and asking the questions to their providers, to their dentists, like taking a proactive stance in their own health and showing these kind of things to the public so that they can be more aware and educated, because like as you said, you can be working with different dentists and doctors and they won't even have a clue, and they don't want to have a clue. They need their patient to start asking the questions. So
I agree.
I totally thank you for this opportunity and for watching this and for educating us.
And I agree, darling.
So, thank you. I really appreciate it. Super Bowl and we're watching Viagra commercials. So, really, if we could be bringing this kind of information, we talk about the impact we can make on people. But anyway, a couple more questions. I'm going to cut everybody loose and then you can come see me personally and we'll go.
I just wanted to thank you too. That was very powerful. But recently, I think it was just last week, Harry and I had gone to a dental hygiene study club with a periodontist, and we meet every other month. And this was the topic, so it was pretty powerful to be able to hear it all over again. And some of the things that he talked about and what he suggested was also very powerful, and I thought we could talk about it maybe in our next dental hygiene meeting.
Sure.
But one of the things that he had suggested too is a lot of our diabetes patients aren't really aware of how well controlled their diabetes is, and to ask them what their, I think it's the A1C levels, and to be able to have them know what their numbers are so they can follow and see how things respond, especially if they're going to have treatment. appointment with the dental hygienist for scaling and root planing. And he had suggested too to, like if we are gonna do some type of treatment like scaling and root planing, to fax a letter over to the doctor, tell him what you're gonna be doing, give us a report of what their A1C levels have been over the last 2 years. And then just kind of follow up with that after the treatment's been done. Because he did share, he had one patient who went through the whole procedure and treatment, and at his 1-year follow-up, he came back to the doctor and was just so appreciative that with the treatment that he had done and just keeping up with his home care, he was able to actually get off of his diabetes.
Oh, that's already out.
So
it just shows,
it's right, huge. So that's awesome. And you wanting to collaborate, like if there's nurses or nurse practitioners or doctors in the house, they'll tell you that they're there's all kinds of cuts being made. You know, they're asked to see more patients, nurses and nurse practitioners and doctors to do more with less time, more paperwork. The fact that they have somebody else helping them, you know, with their patient, I'm sure they would appreciate it. And like technology is coming along too, so like we're like a year or two away from H1AC tests, so that's exciting. Last question.
Okay, it's not really a question. I guess I just wanted to say, so we all go to our doctors, right? Everybody goes to see their medical care provider. Educate them and tell them, hey, are you screening people for oral health? Because I got that from that. Hey, are medical doctors saying, what is your periodontal like? What did your dentist say? So I'm just saying, educate. We are educators as hygienists, as dental providers. Tell them, hey, are you screening your patients for your dental health?
Exactly.
So, just so that there's that connection, because that connection is huge. I feel like medical providers don't ask enough, what's going on with your mouth? What's going on with your oral health? What did your dentist say? What did your dental hygienist say? So I guess as us, as educators, ask your healthcare provider, are you asking your patients what's going on? So not a question, just a little.
Yeah. No, that's a great question statement, and like I said, you know, we're all in it together. And I will tell you, from having family members on the medicine side, I'm on the dentistry side, they're slammed. You know? So the fact
So
that
are we though.
no, I know. So we're in it. My point is like that we're in it together. We're really in.
But it is,
we're in the trenches. The only way we'll ever affect any kind of change is, like you're saying, give them a call, like to know that one patient care. So like that little bit of collaboration,
and then
then it builds. You know, like one little step at a time. So anyway, thank you guys so much. Amazing questions. You know,